Hello, I'm Dr. Anil Gudi, and today we talk briefly about day 7 blastocysts. And remember, a lot of laboratories are now culturing till day 7, and there are a few papers, and this is one of the papers which has thrown light on the euploidy rate that it can be coming up looking at the day 7 embryos. So this was a paper which is saying, was it worth a wait? And the study question here was, does the reproductive potential of a blastocyst change when it takes longer, accounting for aneuploidy, and then does it have an endometrial egg or an embryo synchrony, and does it affect that? Now, this paper was quite an extensive paper, and there are many studies which have looked at this and said that a day 7 embryo, the overall blastocyst development is lower and implantation is reduced. Now, the range of normal blastuation also differs, and the window of blastuation may also be different. What we do know is that as women get older, they tend to take longer to produce a blastocyst. And sometimes this can go up till day 6 and day 7. So, over 2 years, this study was done, and these embryos were screened by the NGS-PGTA technology. 31.6% of embryos were usable on day 5, 65.1% on day 6, and 3.3% on day 7. Now, what they noticed is that if one blastocyst was available on day 5, then 9.2% had a day 7 embryo. If none of the embryos reached day 5 or day 6, then 13% had a blastocyst on day 7. So a smaller proportion did reach day 7. Now, if you look at the euploidy rate for women under 35, you're looking at a phenomenally high euploidy rate of day 5 embryos having the best euploidy rate, and that steadily decreases by day 7. Have a look at all ages, and especially the ages of between 40 and 42, the chances of getting a euploid embryo at that age is quite less anyway. But on the other hand, if you get a euploid embryo on day 5, your chance of getting a day 6 and day 7 tend to go lower and lower. Now, study after study have shown this, that once you start crossing the ages in Caucasian women of between 38, you are going to see a larger proportion of embryos which are going to be abnormal. Now, is it reasonable to freeze embryos till day 7? And the answer is yes. It increases the pool of transferable embryos. Day 7 embryos are more likely to be aneuploid. Slow blastuation may involve other factors than just aneuploidy. So the mitochondria could be working, the culture materials, the way the embryo responds. Hammond looked at 10 studies and only 5 reported on genetic screening, and there was a lower aneuploidy rate in day 7. And that's what that study looked at. The endometrial window is also going to change, and there's no doubt. So day 6 and day 7 embryos are better preserved. There was one study which looked at perinatal outcome at day 7, and there seem to be similar outcomes to day 5 and day 6 in terms of gestational age, preterm delivery rate, average birth rate, and the presence of abnormalities. So, from an embryology point of view, I think it is reasonable to start culturing embryos till day 7, realizing that the aneuploidy rate is going to be higher, and you have to question whether it is something which you clearly tell patients. And if you are having PGTA to be being used where genetic screening can be done, I think it is necessary that you do it, so at least you'll be able to give them an idea whether it is worthwhile replacing these